Hello, and welcome back to the Planning Pulse podcast with you, as always, Matt Harvison, the Principal Practice Lead for all things Workday Adaptive Planning at Ikorio. Joining me again today as we wrap up our Life Sciences mini-series, my Senior Solution Strategist, Tom Trammel. Tom, how are we doing?
I'm doing great. Happy to be here.
Yeah, I love it. I love it. And like I mentioned, we're going to be wrapping up our Life Sciences mini-series, all about planning for life sciences, biotech, pharma companies. And really, when I'm thinking about planning for life sciences, I want to start by talking about planning for life and planning for life specifically for you, Tom. How are you planning for life as the nor'easter is approaching landfall over in the Northeast?
We're hunkered down. A lot of snowfall this morning and looking like there's going to be some more this afternoon. So just got to make a mad dash to the grocery store here soon and then hunker down.
The mad dash to the grocery store is always one of my favorites. I know we had snow here in Dallas a few weeks ago, and schools were closed for 4 days. So I don't know
yeah,
what school looks like there for you up in the Northeast,
yeah.
but be sure to get your
They're pretty
bread
used to
and
this.
milk.
Yeah,
Yeah, yeah,
yeah.
bread
This
and
is
milk.
pretty. Yeah, yeah. The number of guys that are driving around with their trucks and the plows on them is, they know what they're doing.
No, I love, yeah, we certainly don't know what we're doing down here in Dallas, but when I'm talking about what people do know, sort of what they're doing, specifically anybody at Ikorio, we know what we're doing when it
Mhm.
comes to workday adaptive planning, particularly around life sciences. And we're going to wrap up the mini series today. This is the third episode. The first one went all into clinical trial forecasting, getting into the nitty gritty there. The second one went into the cost side and looking at the manufacturing of different drugs. This third one is let's move beyond the pre-revenue phase and getting into post-revenue generation. We're going to be looking at revenue generation maybe from collaboration revenue, from dose or unit-based revenue. But as always, our listeners, our followers are not here to hear me talk about nor'easters or about movies or about the Matrix or anything like that, but getting straight into product demonstrations. So with
Mhm.
that, Tom, maybe you want to walk us through
Yeah.
what we've got built out for our viewers here today.
Yeah, absolutely. So, when you're in that organization that has started out in that research and development, really focusing on developing your processes, your products or services that you're developing, eventually you're going to get to the point where we have that now we have to actually have that revenue. We're in that post-revenue creating stage. And so Adaptive has a lot of great tools for revenue planning. And so I've put together a little dashboard here that kind of illustrates a few of those examples of how, an organization that has now moved on to this phase can utilize Adaptive to plan for things such as, those ARR forecasts. Those are going to be your subscriptions. You have these relationships with these customers that have these recurring revenue, and this could be for supplying your different medications that you've developed, medical devices, or even just a licensing for your intellectual property that you've been developing. That could be something. And so whatever CRM you're using, we can integrate with it, bring in your full active customer list, and as well as a pipeline so that your sales team can have that true view all the way through of what does our pipeline look like, what's our active customer list, how are we going to maintain them, and then we get our forecast that from your normal ARR down to a net new and down to an MRR to get you that rolling forecast on that basis. So that's one area that you might be moving into. Other types of organizations may be more on the, unit sales, dosages, products, and so, or even, individual services. So looking at something on the lines of the services, we have these contracts potentially with various different, companies that are administering clinical trials, and they come to us to do the actual administration. So they'll come to us, here's our partner, this is the program we're working with them on, we've licensed for this phase, for this duration. So this is an example of how we could put together a very simple way to track and to forecast. If I come up here and click on row details, we can go back in to see what are the calculations that are being done. So this one begins in February. So for our invoicing schedule, we have that hitting the first off. So that's going to really affect our cash. Like what's our days sales outstanding? What's the terms on the invoice? And then that monthly revenue recognition as we complete those services and can recognize that revenue that we've recorded previously.
So,
It's
Tom, in
another
that
example.
example that you had there, it looks like
Hmm.
calculations that we have in these models are going to make an impact, right, to our income statement, to our
Hmm.
balance sheet, undoubtedly our cash flow. And we think of all of
Absolutely.
the core three financial statements for whether you're life sciences, whether you're any type of other industry or customer, being able to generate the core three financial statements inside of Adaptive is something that's really, really big. And it's
Yeah.
especially important inside of life sciences when you think of the cash runway for some of
Hmm.
those pre-revenue organizations that may be out there. But in this case, it's
Yeah.
going to be just as important as you start to move into the revenue phase here as well.
Right. Right. We're carrying forward those same themes, those same processes and methodologies used previously. Now we're just in the using them in the context of, revenue producing. How are we tracking this? Who are our customers, et cetera. And so we really, really can, use adaptive and use variables in our sheets right here to keep track of that cash runway opposed to what your typical gap revenue recognition would look like, which obviously, is not going to correlate exactly to, how much cash we have in the bank. So,
Yeah,
um,
absolutely.
yeah, product sales, that's another one that, Adaptive is just bread and butter to keep track of, product sales. So, a couple of the graphics here, looking at the different product mixes and customer mixes. And I know this says units. This could be, again, anything that that you're selling and have those customers that you're distributing these to could be, dosages, it could be units, it could be, anything like that that's going to give you that unit of measurement that you track those sales by. And so coming down into the model I put together here, we have all of our historical actuals, and then we move straight into our planning forecast. And you can see the level of granularity that we can plan this with. If I open this up, we can see we have parameters for, your by customer and by product, and then a few attributes that help us organize the data if we wanted to move things around and get a little different view. But these type of models, very, very similar to how we would set them up in Excel. But it gives us the benefit of making it so easy to put all of these pieces together. And like you said, everything comes back to the income statement, the balance sheet, the cash flow statement. Very, very easy to reference those. And using the versioning, we could do comparisons against any point in time that we've iterated a forecast to make sure that we're still progressing, we're still moving forward and hitting, moving towards our goals. And so, yeah, very flexible, very dynamic, and can really accommodate, any organization. But in this, and specifically this context, these life sciences
Mhm.
organizations that are moving from that pre-revenue stage, moving into the time that now this is something that we've got to focus on, and we've got to figure out a plan and keep track of it.
Yeah, absolutely. I know you said a few really great notes there as we went through the last couple of planning models, specifically when we started to talk about product revenue and looking at
Mhm.
dosages or unit-based product revenue. You had mentioned that it's almost like doing it inside of Excel. You can get to the level of granularity
Yeah.
that you're looking for. But as we said in the first episode of this mini series and reiterated in the second and the third, life sciences and biotech companies, we're
Mhm.
not just trying to hit the budgetary numbers. We're not just trying to make sure
Right.
expenses hits a certain dollar amount. We want to make sure that we're protecting the cash that we have and being able
Yeah.
to have a dynamic forecast that allows us to be able to make
Yeah.
changes, make tweaks on the fly using scenario controls, what if scenario
Hmm.
analysis, just like you pointed out here. It's
Hmm.
incredibly important to organizations here that we're using our cash to go to the right things, the right milestones,
Absolutely.
making sure that we're doing everything as efficiently and effectively as possible. So, Tom, appreciate you walking us through the
Yeah.
demonstration. This concludes our mini series on life sciences, biotech. Again, we went into pre-revenue. We're into revenue generating as well.
Mhm.
But this is going to wrap our mini series on this particular industry. I would encourage you to reach out to us at sales@acoreo.com if you want to learn a little bit more about how some of these models may work for you or your organization. Of course, we'd love to show you a little bit more custom tailored demonstration. But Tom, I want to ask, we went through a lot of different things with this particular industry. I want to ask, is there anything maybe that you want to leave as a lasting note for our viewers here when it comes to planning using adaptive
Yeah.
for life sciences and biotech companies?
Yeah, I have some direct experience. I was in healthcare for a lot of my career before moving over to this side of this side of the table. A big worry is always going to be the amount of data. There's a lot of data when it comes to research and healthcare and all these things that can be lumped into the category of life sciences or biotech. And, having adaptive and the backing of Workday and having the technology that's built into it, managing that vast amount of data is totally manageable. It's not something that we should be intimidated about or you should be intimidated about. And, you know, we can take all that data and a tool like Adaptive can make it usable because otherwise it's just a huge spreadsheet on somebody's file, desktop that, we can pivot and try to look at and get some KPIs and metrics out of it. But a tool like Adaptive, when I was in healthcare, really, really was that difference maker in being able to use the data that we were getting from the R&D teams and the clinics, et cetera, et cetera. So yeah,
Yeah,
don't
absolutely.
be hesitant if you think that we've got too much data. Adaptive can handle it.
Yeah. And that's one of the things I just, love hearing you reiterate is the experience
Mhm.
that you have in the space and saying,
Mhm.
don't be intimidated by a solution like Workday Adaptive Planning, being able to handle your data volumes. I know, Tom, you should be a little bit intimidated based off of the snow that is falling up there in the Northeast, but want to take this opportunity to say thank you again for providing
Yeah.
your demo skills on our webinar here as we conclude this series on life sciences. We are going to be back next week with another episode of the Planning Pulse podcast. You can plan on it.